Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it is my privilege to be the host for this program that is brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals focused on improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. James Wright. Dr. Wright has been the medical director for emergency medicine at Transylvania Regional and Highlands Cashers Hospitals for the last 5 years. He also serves on the board for Pisgah Health Foundation. Dr. Wright, thank you so much for joining us and welcome to the program.
Hello, Angela. I'd like to talk a little bit today about what to do if you think you are sick from the coronavirus. First of all, I want to draw your attention to the CDC site, which provides a lot of good information as to what to do and gives you information as to whether or not your illness may be considered mild or severe. If you go to cdc.gov/coronavirus, you'll reach a site that asks you what to do if you are sick. In the lower right-hand corner, there's a little orange box, and it's a self-checker. That box will take you through a series of questions which will give you advice on what you should do from here. What I'd like to do is to talk with you a little bit about mild and moderate disease, and then a little bit about what to do for severe disease. The symptoms of the coronavirus are headache, fever, sore throat, body aches, and malaise. Sometimes people have diarrhea. More recently, we've also discovered that some people lose their taste and smell. So if you're having trouble tasting and smelling and you develop flu symptoms, you may indeed have the coronavirus. If you have a mild to moderate disease, we want you to stay home. We don't want you to come to the health facility, to the doctor's office, because that exposes other people to the illness. And if we get you in that environment, the healthcare workers have to take care and don protective equipment in order to keep themselves from coming down with the virus. There are an insufficient number of tests to test everyone. So currently we are only testing people who are sick enough to be admitted to hospital. We are also testing healthcare workers who may have been exposed. But people with mild to moderate disease are not going to receive a test for coronavirus, whether they go to the doctor's office or to the emergency room. So stay home, stay in touch with your doctor. Avoid public transportation. Currently, we're all on the stay-home order from the governor, so that should pertain to everything we do. In your home, you want to separate yourself from others. This is known as home isolation. Please don't share a bathroom or a bedroom with other people in your house who may not be ill. You may transmit the virus that way. If you need to go see your doctor, call ahead. Let them know that you may have coronavirus. The doctor may postpone your appointment. He may tell you to go to the emergency room. He may tell you what to do to take care of yourself. But that will prevent unnecessarily exposing other people. If you are sick, you should wear a face mask when other people are in the room with you. If you are unable to wear a face mask, then other people should wear one when they come in the room with you. The face mask will prevent you from transmitting the disease. And in many cases, the face mask will keep us from touching our face, which is another way we can obtain the infection. Currently, there's a shortage of face masks, so you may have to fashion one from a scarf or a bandana. Cover your sneezes and your coughs. Use tissue if you can. If not, your elbow. Throw away the tissues in a lined trash can, and be very sure to wash your hands immediately after doing this. Washing your hands is a 20-second process. That's long enough to sing happy birthday to yourself twice. Be careful to pay attention to your elbow, your thumbs when you wash your hands. And if you use an alcohol-based sanitizer, make sure it's at least 60% alcohol. I cannot stress to you the importance of washing your hands all the time. Whenever you touch anything, such as a tissue, whenever you touch anything in a room with someone who's sick, preparing food, wash your hands with soap and water. And using a hand sanitizer is important. Avoid touching your eyes, your nose, and your mouth, especially if your hands are unwashed. We can receive the coronavirus through coughing and sneezing. It'll stay in aerosol for 3 hours after coughing and sneezing. We know that on surfaces in the environment, the virus can survive for hours on cardboard, and it can survive up to 3 days on the surfaces that are plastic or metal. So these surfaces should be cleaned thoroughly and frequently. And after you clean them, be sure once again to wash your hands. Household disinfectants are effective in killing the virus. So once you clean a surface with soap and water, use a household disinfectant. Now monitor your symptoms. These are fever and cough predominantly. If you should develop trouble breathing, this is a more serious symptom, and this means you need medical attention. If you are having trouble breathing, seek medical attention, but call your doctor first or call the emergency room to let them know that you're coming in and you may have coronavirus. Wear a face mask if it is available. If not, you can use the bandana or the scarf. Stay 6 feet away from other people and follow the instructions that are given to you by your healthcare provider or by the emergency room. It's very important that if you have any emergency warning signs, that you get medical attention immediately. These consist of trouble breathing, persistent pain or pressure in your chest, confusion or inability to arouse yourself or for other people to arouse you, or a bluish discoloration of your lips or face. These are not all the emergency warning signs, but should you develop any of these, you need immediate medical attention. If you feel as though you have an emergency, call 911 and let them know again that you think you may have COVID-19. If possible, put on a face mask before help arrives. These are important steps to keep yourself healthy and to make sure you get attention when you need it. And the question arises as to when you can discontinue home isolation. You can discontinue home isolation when it's determined that you're not contagious. There are 3 things that need to happen if you have not been tested. 1, you should have no fever for at least 72 hours. And that's in the absence of any medicine that reduces fevers, such as ibuprofen or Tylenol. If your cough and shortness of breath have improved, and it has been 7 days since your symptoms first appeared. If all 3 of these things occur, you can discontinue your isolation. If you have been tested and you no longer have a fever, and your cough and shortness of breath have improved, you need to have 2 negative tests in a row, 24 hours apart, before you discontinue your isolation. I hope this information will prove helpful to you and that you stay healthy. Thank you.
Dr. Wright, thank you so very much. We certainly do hope that our audience stays healthy, but those tips and that information is extraordinarily important should someone start to feel sick. So thank you so much for sharing with us this
Did it
evening.
sound okay?
It was great. And we want to also thank our Wildflower Media creative and technical team. In addition, we would like to thank the Physicians Roundtable as well as the staff and board at Pisgah Health Foundation for the incredible job they continue to do in these challenging times. If you would like to reach out to Pisgah Health Foundation, you may email them at info@pisgahhealthfoundation.org. We encourage our listeners stay tuned as we continue to bring informational videos such as this one to you. Everyone stay healthy, stay well.